The world abruptly changed in the spring of 2020. Everyone had to adapt to new rules, new fears, new realities. But fire didn't seem to notice. It went on about its deadly business as usual, wreaking havoc and destroying people's lives. Undeterred by an invisible virus, fire continued to test both those tasked with fighting it and those dedicated to caring for its survivors. And to the surprise of no one who works with them, those heroes rose to the occasion.
Our folks never stopped. While the general public was quarantined to their houses and not being allowed out on the street, which we were very thankful for, our members were coming to work every day throughout the entire pandemic from start to finish.
Is there a more dangerous and more demanding task than fighting fires or bringing first aid to those injured by them? Now imagine this job made even harder by masks and new special protocols. Imagine your fire department depleted in numbers by a virus that doesn't care who it infects, and yet New Jersey's firefighters never missed a step.
So the role that COVID had personally on us coming to work was scary. It was scary for everybody. We were going out there and dealing with something that we've never dealt with before, something unknown, something that we didn't know in the very beginning how it was transmitted, how we can protect ourselves the best way. So it took a lot of mental stress that was added to our members every day.
The pandemic impacted staffing significantly on many different levels. For our small departments, it pretty much wiped them out at times. If they had a small roll call to begin with, you lose a couple of people, it just brought you down to nothing. In our bigger departments, we had situations where we had, at some point, dozens and dozens out at the same time, which is very, very difficult to absorb. It really increased our call volume dramatically. There was the actual COVID calls, which when it was in its prime, it certainly took a psychological toll. We saw people that expired.
Not everybody made it home. The FMBA suffered a great loss in Izzy Tolentino from Local 13 in Passaic. Izzy was a young firefighter that his whole life he wanted to be a firefighter, was a firefighter for a short time due to the pandemic. Izzy went to work, did his job, and unfortunately contracted the disease, and we lost Izzy due to COVID-19.
Personal level, it made it very difficult for a lot of our guys' family lives at home. They had children, they had wives, girlfriends, parents. Some of our younger members still live at home. They didn't want to go home if they had elderly parents or they had immunocompromised family.
Is there a more urgent, more demanding task than caring for those suffering from burn injuries? Now imagine this job made even harder by extra protective equipment and new, special protocols. Imagine a burn team dealing with a virus that doesn't care who it infects, able to further compromise already compromised patients. And yet the staff at the burn center at Cooperman Barnabas met this challenge head on.
Coming to work during the pandemic, you never knew what you were walking into. You never knew what kind of patients you were going to be taking care of, how sick they would be, if you were even going to be a burn doctor for the day or you were going to be a COVID doctor for the day. And you knew most of the people you were taking care of weren't going to leave the hospital.
For us, the issue was, can you find enough people who were healthy enough and who could work the long shifts? Yet another problem or obstacle was that burn patients require surgeries. The operating rooms were shut down during the pandemic. The operating rooms became ICU rooms. So to get patients to the operating room for burn surgeries was a challenge.
One of the toughest things that all of us in the burn center dealt with was the inability to interact with our patients' families and being able to console them during these difficult times. In the burn center here, we generally have very strong relationships with our patients' families when they're going through such tragic moments. And during COVID, there were no visitors in the hospital. The hallways were empty. You would be in a room with the patient holding an iPad, hoping the family could spend a little quality time with the patient, not knowing if they'd even see them again.
In the end, we could not have done all the things that we did here at the medical center if it had not been for the EMS workers and the firefighters who put themselves on the line every day to bring both burn patients and COVID patients to the medical center.
Over the past year and a half, we learned a lot about the sense of duty displayed by so many. Parents still had to put food on the table. Sanitation workers still had to pick up the trash. Cashiers still had to check out groceries. Closer to home, fires still had to be fought, and those injured by them still had to be healed. And they were, with persistence and courage, with energy and clear thinking in the face of exhaustion and turmoil. Among these heroes are an extraordinary few worthy of special attention, who go above and beyond the high goals we have come to rely upon each and every day. Without their bravery, there would be no inspiring stories. So tonight, we honor our firefighters everywhere, and especially our 2022 Valor Award honorees.